So my name is Dr. Joe Caudill. I'm the state deer research biologist for Indiana DNR. And I'm going to talk to you today about how we go about sampling deer for EHD. Now, one of the most important things to remember is that the deer has to be fresh. Typically, we like to have somebody report a sick deer and then have a conservation officer or some other law enforcement officer go ahead and euthanize the deer for us. That way we know exactly how long the deer's been dead, and we can ensure that when we go out to try to collect our samples, we're going to get a fresh deer, a deer that can be tested. Otherwise, we could spend a lot of time running around the state trying to collect deer. So what we do is we collect the spleen. Now the spleen is located on the left-hand side, so typically what I like to do is lay the deer down on its right-hand side. You can see here where I'm cutting at is just right along the last rib, and I just open up the deer a little bit so that I can get in there and see the spleen. If you lay the deer down on its right hand side where its left hand is up, the spleen is laying on top of the rumen or the stomach, just below the backbone and just behind that rib. So what that does is that gives you a good reference that when we're going in and sampling these, we're not just having to gut the entire deer, pull everything out, and then search around for the spleen. Now the spleen is an organ that looks very similar to a piece of liver, except it's much flatter and a little bit more pinkish red. And if you cut into it, it's a very, very deep, dark, almost black red. And so that's the easiest way to tell what I'm looking for, is I just double check when I cut it open. I just make sure it's nice and dark red. Now that's the main tissue that we need. Other tissues and fluids that we can use are, we like to take a piece of liver, which is what I'm doing here. Of course, when you have the spleen exposed on the top there, the liver tends to be on the bottom side, on the underside of the rumen. So I cut in a little bit deeper here and reach up underneath the rumen or the stomach and pull out a piece of liver. Sometimes we get a piece of kidney, which is located on either side of kind of the back wall of the deer, on the inside, just below the spine. And another tissue that's often useful to get is a piece of lung. The main tissue that we really need is the spleen. If we have the spleen, they can test a deer for EHD. But again, that's got to be fresh. To get the lung, what I do is I typically make another incision about halfway up along the ribs, pull out a piece of lung, and just trim it off like I'm doing here. These go into some sort of a plastic bag. Here I'm using what we call Whirl-Pak bags. They twist down, and then we put the samples in a cooler because they have to be kept cool and refrigerated and not frozen. Another tissue or another fluid that we can get is some blood, but typically we most oftentimes just collect the tissues and get those to the lab. And as you can see, you can actually sample a deer fairly quickly, and then we go through and we collect various data on the deer, the location, the county where it was found, and so forth.